Hi, my name is Jung with the MBhealth Insurance Agency here in St. Louis, Missouri. Today I want to talk about what you need to know about dental insurance from year to year. So whenever somebody calls me asking about dental care, there's a few things that I think are important that we talk about. Annual maximum, how much are they going to pay in a given year? Is that going to be $1,500, $2,000? Is it going to be unlimited? Some plans are like that. Also, waiting periods. Am I going to be able to use it from day one? Do I have to wait 6 months for a basic service or 12 months for a major? Well, that would be disappointing if you need it right away and you can't use it. Now you're paying a premium for nothing. And then they also want to talk about, my dentist. Are they in network? And can I go here versus a different place? And so those are kind of the three main pieces I focus in on. So let's kind of delve into them a little bit more detail. So annual maximum. That's the amount that a dental carrier is going to pay per person. And so I feel like the higher I can get that, the better I'm getting in my dental premium okay? So for instance, if I've got a 1,000 annual max, well, that's not a lot of benefit if I have things going on. So that's why I try to push that up, either 1,500 or 2,000 or unlimited. But now the structure of the plan could be very different. So those are the things you want to be sure you're looking at. But if I'm getting more for my money, I feel better with it, okay? Waiting periods, always a problem. If you call me and I ask, well, what makes you think about a dental plan? And you're like, well, man, I got a real big pain going on in my mouth. I need to get it checked out. Well, then obviously we need something that has no waiting periods because we need to use it from day one. Because if you get set up with a plan or you go out and pick one, and then you find out that it doesn't have major services for the first 12 months, I feel like you've defeated the purpose, okay? You'll be very frustrated. And then I think the last one, to some degree, that I think is the most important is the dentist. When people call me, I first ask them, do you have a dental provider that you see? Because if they say yes, I have a tendency to believe that people will change their primary care doctor before their dentist. And so that's why if I'm selling you a plan, you can't go to that dentist, well, then it's pointless. I think it's important to ask your dentist, do they have a plan they prefer? Like, do they like a United Healthcare or a Delta or a Cigna, or somebody that's out there that we have access to selling? Because at that point, now I'm even doing you a better service, making sure I'm putting you with a plan not only you're going to be happy with, but your dentist will be, okay? So I think that's an area that a lot of people make a mistake, okay? But that doesn't mean that if you call me and you're like, well, I don't have a dentist, well, great. Now we can look at anything, okay? Now it's what is the plan the most important to you for that moment. Preventative care is a big deal. Everybody asks me about preventative care. And I always say this, if you get your 2 routine preventative visits per calendar year, typically they're paid at 100%. Well, I feel like you break even. It's when you have that root canal, when you have that crown. That's when a dental plan, you want it to be there for you. You want to have that security. So that's what I want to talk to people about. So look us up at MBhealth Insurance Agency or give us a call at 314-544-5400 and let us help you with your smile. Take care.